Thank you. That was terrific. I would like to invite our previous speakers, Drs. Myers, Carniel, Marth, and Corrali, up to our panel discussion. And I'm delighted to see our other panelists join. We're really excited to have the company of Dr. Maria Neira, who is the Director of the Department of Environment, Climate Change, and Health at the World Health Organization. Please come up. Thank you so much. Thank you so much. I'm going to take moderator's privilege here and ask if Dr. Neira would like to make any remarks to start us off, since you've just joined. Thank you. I know it's a very busy 2 days you have ahead and beyond with you and we.
Thank you so much, and it's really a pleasure to be here. Not only because this room is so nostalgic for me, because my School of Medicine, most of the classes were on a very similar room. So I'm feeling few years younger than before I came in. You don't need to know how many. One of the reasons why you mentioned that we are busy, and I thank you so much for the invitation, is because, as you know, the General Assembly is taking place, maybe not, but taking place, yes. And so we are having all nations here. Call me naive if you want, but I still believe, hi Wen, lovely to see you. I still believe that this is extremely important to have the nations united and fighting for different purposes. A few months ago, the UN Environmental Program, on their assembly, they adopted a resolution on a plastic treaty. So it's extremely important from a public health point of view that we start to get, with all the science that we are collecting and all of that, how can we start to reduce our carbon footprint, our plastic use? And you know that the medical community, the medical services can contribute enormously to that. We have put in place a platform called Attach, where we are looking at procurement issues and how we can reduce this use of plastic. And we are still trying to develop all the science that is needed, and thank you very much for your presentation. In WHO, we did a couple of reports with many experts that I'm sure that some of them are in this room at the moment. One, we were looking at the microplastics in water bottles, and the other one was looking at in food. And it's still one of the main conclusions, unfortunately, is that we need to do much more research. So we were looking as well as how to update the endocrine disrupting chemicals state of the art, and how to do it on a very smart way, because it's clearly that if we go chemical by chemical, we will never make it. So we will be focusing on what are the key health hazards that we are kind of anticipating, and what are the recommendations we can make for policymakers, for those who are attending now the General Assembly, and particularly giving them no excuses. Clearly, we need plastics at the healthcare facilities. It's one of the big demands that we have, but we clearly as well, we can reduce the use and push for having more different technologies for replacing those plastics that we are using now without compromising at any point the use of those plastics. 25% of those chemicals that are contained in the plastics are considered harmful for our human health. So clearly it's an issue for public health community and for the medical community. And as a health sector, we need to commit to reduce that use and accelerate this transition to other ways of having good healthcare and reducing our use of plastics at the health services and health system. So with that, I'm very pleased to be here, and thank you for all the initiatives you are putting in place. Of course, the health sector needs to be considered a little bit on a special case, but there is no reason why we cannot make our contribution as well and push for advancing on the reduction of the plastic. At the moment, I'm sure you saw those horrible pictures with tons of plastic in the oceans. I mean, when we are trying to demonstrate and they say, is there any scientific evidence proving that the plastic are affecting our human health? Well, maybe we don't have all the answers, but the other question I'm always using to get back to all of them is, do you have any evidence that this is good for human health? I mean, how can we have tons, millions of tons of plastic in our oceans and considering this as a kind of good development for all of us? Probably not. So let's do some healthy work on plastics and still protecting human health. Thank you.
Thank you, Dr. Neda. Before I go into some of the questions that are already populated, just a reminder that we're using Slido to upload questions, and I will be, as your moderator, upvoting a number of them. Given and just as a time, we have about 20 minutes to work with in this morning's session. So I hope to do my best and get as many addressed as possible. If I could build off Dr. Neda's comment and open with a question, that was submitted. How can we better educate the medical community about plastics and human health?
Can I maybe start? I don't think we need to educate because they don't want to be educated, but I don't want to be educated. We want to be aware. And I have to say that there is now the health community is waking up very much to this issue of climate change and pollution, and they are very motivated with this, what we call the green in the health sector, the reduction on the procurement and the use of plastics and other procurement supplies that are contributing to the carbon footprint. They feel very, very, very engaged. And I think we need to lead by example, and there are good advocacy campaigns now that they can help on that. But education is another thing. Yes.
Pete?
There, that's on. I want to introduce Rob Sargis to this group. Rob, could you raise your hand, please? Rob is an endocrinologist at University of Illinois, Chicago, and he wrote a brilliant article with his colleagues a couple of years ago in the Journal of the Endocrine Society, directly addressing a key part of this, which is physicians, we first have to do no harm. And yet a dramatic percentage of the equipment that we use in medicine is taking endocrine disrupting chemicals and infusing it into the bodies of our patients. We have to learn that, and we have to get behind the efforts to make that change. Rob, if I could, I would ask you to add comments to it. There he is. Raise your hand again. Talk to Rob.
And just to add, Dr. Sargis will be addressing the symposium this afternoon. So we're excited to have him be speaking. And I think the motive of the question is not just focusing on the use of plastic materials in medical care, but also the opportunity of patient encounters for all healthcare providers as opportunities to guide and prevent ongoing exposure and potentially intervene to prevent both disease to begin with and trajectory of illness if you have a disease. But thank you. This session is meant to set the stage for an ongoing bevy of presentations around the science of plastic and human health. We've seen a number of different themes, climate and endocrine disruption, come through already in some of the discussion so far. Could I ask, how can we better bring the climate and endocrine disrupting communities together, the scientist communities together, particularly given the potential for co-benefits of plastic production prevention? That's a mouthful. It's another 3 Ps for those of you in the space.
This one, yeah, I think so. I think I will start with we know plastic pollution is multidimensional, right? It's not just climate, it's not just in like health, but there's microplastics, many others, right? Chemicals of concerns, problematic plastics, biodiversity, everything, right? This is such a complex product material. Any measures or any action that will be in isolation will be potentially wrong, right? So I think we need a more holistic approach here, more systems-wide thinking. When we are, because in the history, in the past, we have examples. When we look at a problem in an isolation, in 5 years, 10 years from now, we actually created another problem in another aspect. We didn't know at the time because we were looking only with one glasses, right? So that's why I think we all have to be together with the systems thinking, this holistic approach. These problems needs to be addressed together. And another problem with the isolating measures are, like for example, we're talking about recycling, right? We're talking about chemical recycling. We said it's not working, right? Here's the fact: some recycling processes could benefit, let's say, one aspect, like we are taking plastic from environment, but it has a huge carbon footprint. So knowing that huge carbon footprint, would you do that? Would you still go with that, right? So all those other environmental or social negative impacts needs to be accounted when we are doing it. That's why I think I want to mention the holistic approach. So we have to be always considerate about the multiple dimensions of problems we're having.
Can you just, first let me disclose some information. I'm an endocrinologist by training, or I should say I was. I don't know whether I'm still qualifying, but and I have to say that there is still a lack of knowledge among our society about what endocrine disrupting chemicals are. And apart from some headlines from time to time, we are bringing a lot of different societies to the climate change agenda, pediatricians because of air pollution, respiratory societies and cardiovascular specialists and all of that. I think it's time to bring endocrinologists as well to this dialogue. First, because as you rightly say, and it's extremely important, this is a very cross-cutting issue. We cannot, to fix one little piece, maybe we will create an incredible imbalance in other issues. And we did that in the past with the diesel cars, for instance, for environmental reasons, and we didn't look at the impact it was having on our health. So, but by bringing it to the environmental health, One Health approach, this is the way we can have maybe, hopefully, some impact. But we need to raise awareness among our society, and for that, we need endocrinologists to speak up on a very simple language to explain to the people, scaring them, but at the same time telling them how to consume in a different way without compromising again the healthcare.
Okay, just wanted to add quickly, I agree with all of the previous speakers, but we need to create spaces for the scientists from these different fields to meet and contribute their knowledge to the solutions that we're going to be probably struggling in some cases to find going forward. And as Nihan said, our solutions do need to be holistic and take a systemic understanding of the problems and the solutions. And that's going to require that the scientists and experts and knowledge holders contributing to this space take the time to do this, because it does take time and it requires communication skills, it requires trust building, it requires exchanges, and there will need to be some platforms somewhere for us to do this. So the treaty space and the future treaty implementation might provide spaces for that. But we need to have clear understandings of safety and sustainability, what we mean by those things and how we'll be assessing them going forward. But we are definitely going to need input from all of the above, different kinds of experts to do this, and people that are willing to put in the hard work, hopefully funded too. That would be super nice.
Thank you. There are there's actually a question building up on funding from the chat that asks, could you please share some of the available funding opportunities in this vital topic to support research? I don't know if we want to take a moment and reflect on that, other than to say more is needed, perhaps.
We need more money.
I do know that there are some funders in the audience, and I won't put anyone on the spot.
Yeah, just a quick comment on that too. Funding is definitely needed, and hopefully this would be public funding that is working towards protecting human health and the environment. And again, back to Senator Whitehouse's comments on conflict of interest, there's also evidence that funding does impact the outcomes of the research. So I would just little note of caution on where the money is coming from and who is maybe driving the research questions and what their goals might be in that work.
Pete, I don't know if you want to add.
Yeah, I'd love to add. I want to shout out someone else in the audience. Jerry Heindel. Jerry, raise your hand. Jerry ran the endocrine disruption funding at NYEHS for decades. He knows funding in this issue. He's now part of the environmental health sciences team, a fabulous resource for people interested in how to obtain public funding of endocrine disruption research. Thank you, Jerry.
There's a little surprise ahead for Jerry on day 2, by the way, but that's all I'll say. I'm going to pivot to some of the science in your individual presentations, if that's okay. There are many questions about policy interventions, what we want to do. I want to suggest in general for the audience that we channel and harness that energy as we go into the end of day 1 and into day 2. Day 2 will be focusing emphatically on the multiple domains of policy action and intervention, and hopefully give us a hopeful message to take away, because so much of this is concerning and frightening at a human level. If I can pivot to some of the scientific questions that I see thus far. One reads, I have heard that microplastics in ice and sand are increasing the speed of iceberg melt and the Earth's temperature because it absorbs heat. Is that true?
I did make reference to this in my work, and I mentioned it when I was speaking, and there is evidence to show that this can be the case. It's not only true of plastics particles, it's also been shown to be true of combustion particles in Arctic ices. So yes, and there have been some studies showing that the temperature changes can also impact organisms that are living in sand, for example, or laying their eggs in sand and so on. So there is evidence that this is occurring. The scale of that problem and how important it is globally versus locally is not determined, and there's definitely more research to be done, so more funding needed. But the short answer is yes.
To turn that question around a little bit, it turns out that the warming and melting of glaciers and the ice cap, et cetera, is liberating decades of deposition of endocrine disrupting compounds that have lain there dormant and beyond the ability to cause harm. They're now being liberated. The famous article written about Swiss glaciers leaking DDT into lakes in Switzerland. It's another dimension of this, a flip side in a way, but it's also part of the problem. And maybe it was an Italian glacier near Switzerland. Jane Monk is from Switzerland.
Thank you. I'm going to just work my way through some of the questions that have populated. Can you talk about the direct health effects, of the production of plastics and CCS, I assume that's carbon capture, including CO2 pipelines for CCS?
So I don't have a direct research related to that question, so I cannot talk about the health impact with knowledge, but there's studies indicating the pollution, air pollution coming from petrochemical plants, which has a direct health impact, right? But again, I'm not the expert to comment on the direct health impact over there.
Yeah, I would just like to add to that there is a lot of evidence for releases of chemicals, of particles, of gases into air, into water, into soil, into food throughout the plastics life cycle, but most definitely at production. And production sites are not built where all the rich people live, they're built where other communities live. So the burdens that are borne by people are not shared equally. There is a large degree of environmental injustice in these questions, and there are people that are being exposed to these chemicals at production sites and facilities in fence line and frontline communities. So this is something that we also need to be aware of as a society as we're looking forward.
And I will say that Joe Banner is going to touch that, I guess, in your presentation. She's also sitting over there.
So stay tuned. We've designed this first day to have many interlocking themes come across. So there'll be multiple opportunities to address this complex and multi-disciplinary Rubik's Cube, if you will. A question about recycling came up that I think is interesting to consider. We heard about how little plastic is recycled, but even if we increase recycling capacity and or adopt economic incentives, does this anyway improve the outlook for chemical exposures or health or economic or environmental burden?
Okay, I'm jumping on this one too. I've done some research around this. So as we heard, there's up to 16,000 chemicals that are used in the production and use of plastics. And we've done some work on mechanical recycling, which is currently the most common way that plastics are recycled. It's the most economically feasible. It's probably the most environmentally friendly, probably. Again, lacks of data here. But what we're finding is that recycled plastics contain many chemicals. And given what I showed you earlier about the complexity of the products and the petrochemical flows through our societies and the waste management streams, we really don't know what is ending up in the recycled plastics that we're working with. There are some more relatively closed loop systems, like with take back systems for drinking bottles with PET, but even there we see an accumulation of toxicants in the plastics over recycling cycles. And in the plastics that I've been looking at in my lab, which are collected from a number of different countries in the global south from small scale mechanical recycling facilities, we're finding not only plastics additives like phthalates, like BPAs, like flame retardants, but we're also finding contaminants. And this is connected to the physical nature of plastics where they can sorb chemicals. And we're finding things like pesticides and pharmaceuticals and other chemicals that are likely sorbing into the plastics during the use or waste phase. And this can potentially render them unfit for use for a lot of different kinds of products. So chemicals are a big problem, chemical additives, but also chemical contaminants are a very big problem in recycled plastics materials. And until we get a handle on that, we can't really use these materials in a safe and sustainable manner.
Pete?
First, I echo exactly what you just said. And second, I draw your attention to a paper that came out recently showing that mechanical recycling of plastics is a great way to produce more nano and microplastics. Not exactly the consequence you want of a recycling process.
And maybe not to forget, to add another risk, and maybe not to forget that in some countries in the global south, the way to so-called recycle is by incineration. So which is having, in most places, they use it, particularly the medical waste, they do incineration, as simple as that, and as terrible as that.
Yeah, and I can add that before recycling starts, plastic products are squeezed, shredded, so they're very tiny. That's why the particles are flying away. That is a big possibility of microplastics are coming out of mechanical recycling facilities. But one other thing is mechanical recycling is not also working for all plastic types, right? For some, and for those it's working, it's actually downgrading, right? So we are downgrading a PET bottle to fibers. So maybe in the first round, you can get a PET bottle to PET bottle recycling from mechanical. Maybe in the second round with a low quality PET bottle, but in the third round, it goes to fibers, right? And it goes to maybe textile. So this is where it's also important that these additives, so with the fiber, maybe you're wearing it, right? With a chemical, fertilizer chemical you don't want actually on your clothing. There's a possibility also with that one, right? So there are many papers talking about how mechanical recycling is not the solution and it's not working as a recycling technology should work. Yeah.
Thank you, Pete. One last
Just add to this discussion briefly. There are lots of recycling schemes that sound wonderful at first glance until you understand the complexities that folks here have been talking about. My favorite example of the solution you don't want is making roads out of plastics. Think about the ways that tires erode plastics to create more and more nano and microplastics. Don't do it. Do not make roads out of plastic.
I'll make a personal addition and add fields, given my son had a soccer match this Saturday, and I saw a big sign on Randall's Island pitching the notion of artificial turf fields to replace grass. But I won't say anything more. In that regard, there's a lot to cover, and I'm a moderator, not a speaker right now. There were a couple of questions that cross-cut an important theme that we're going to come at this symposium often, which is chemicals and microplastics. One question asks about microplastics and nanoplastics as vectors for chemicals. And then another question, and this is open season for what you want to address in your comments. Where do you see that the research should focus on a more urgent basis? Would it be micro and nanoparticles, or would it be chemicals? Given that there are limited standardization methods for quantifying micro and nanoplastics, how would we address this more effectively? So a couple of different seeds have been planted.
So I've worked on the issues of chemicals and plastics for 30 years. We know enough now to use that in making policy. We really do. We don't need to dot every I and cross every T to get to an answer that should be compelling in the policy process. We know much less about micro and nanoplastics. We don't know what role as a vector they play with the certainty I would like. We think they probably do play a role, but we don't know what proportion of the chemicals carried into our brains by nanoplastics, what proportion of that amplifies the chemicals that are already there. Is it bigger or less? There are lots of questions like that. And so even though I am a longtime supporter of more investigation of the chemicals themselves, I know we need more investigation of the micro and nanoplastics.
I'm going to quickly address the vector question on whether micro and nanoplastics can act as vectors. And the answer to that is yes. It depends on a lot of factors. It depends on the polymer, it depends on the size of the particle, it depends on the chemical, it depends on the temperature, the pH, the other food that's available, and so on and so forth. Again, a lot of unanswered questions. However, to put that into context, the work that we're doing in my lab, at least with aquatic ecosystems and movements of chemicals through particles and food chains, we're finding that the chemicals are most likely a much bigger being exposed to organisms via food rather than the particles themselves. And the chemicals can leach out of plastics and they can move through the environment, they can absorb onto plastics. So the way that they're moving and the way that in our guts or in our food systems is important to understand, yes, but whether or not micro and nanoplastics are the major source of exposure to chemicals for us or for fish in the oceans, the answer is likely no. But plastic chemicals are a very significant burden and stressor for ourselves and for organisms in the environment. The question is how we're being exposed to them and how those chemicals are moving through systems. So yes, they can act as vectors, but they're likely not the most significant exposure route. Probably more research needed.
Wonderful. I'm going to do my job here, perhaps my most important job, and try to keep us as much on time as possible. So there's a final question to ask, which hopefully tries to bring some closure to this wonderful discussion. I appreciate that you mentioned trust building and accessible messaging for the science. Do you have words of wisdom or tactics that have worked most effectively to share the urgency of this issue without still instilling alarm and a numbing response in listeners?
Urgency and agency, maybe, are two words we can use together. So explaining the crisis and the problem and how we understand it, but also looking forward to how we might act upon it to avoid this sort of eco-anxiety and numbing effect. So both knowledge, but also tools to work with that knowledge.
And maybe, if I may, this is what we are struggling every day, and how to communicate something without creating eco-anxiety, but at the same time passing the sense of emergency. But maybe we need to be very smart on our tactics here on how to deal with this. We keep doing more research. We keep on answering the very good question that you answered before, but at the same time, look at the end of the problem as well. The thing here is that we need to reduce the use of plastic. I mean, and one day even zero plastic. But and if we say we need more research, we don't have the answers and all of that. I suppose that if somebody from the private sector is sitting here from the chemical industry, they might feel very relaxed and saying, whoa, it will take at least another 20, 40 years to have the evidence. But no, we can start already with all of those messages and why we carry on with the research, still trying to put on the policymakers the responsibility of reducing the use. Because whether we don't know it was the role of the nanoplastics, but if we don't want to have chemicals in our brain, that's for sure. So we need to start to put pressure on the policymakers to reduce the use of chemicals.